following may not be suitable for all audiences. Viewer discretion is advised.
Shopkeeper erased by customer. A Pleasantville shopkeeper was shot dead by a man pretending to be a customer on Thursday. Jala Donaldson, 36, was at his parlor located at the corner of Elm and Mahogany Streets when a man walked in and asked for a cigarette lighter at around midday. The incident was captured on closed-circuit cameras installed at his business place. The footage showed Donaldson inside the parlor and a man wearing a blue jersey cap and his mask pulled down to his chin standing outside. Donaldson placed a cigarette lighter on the counter and the customer handed him cash. He then turned his back to get the man's change, and that was when the customer quickly scanned his surroundings and pulled out a gun and fired several shots at Donaldson. He was hit in the head and upper body. The assailant then picked up the cigarette lighter and escaped. Police said Donaldson died at the scene. A motive for the homicide is not yet known. In January 2018, Donaldson's 26-year-old brother Jamie was among two men who were shot and met their demise while cutting grass near the family's home. And in April 2020, his older brother Kadeem Jordan was driving along Pleasantville Circular when a vehicle crashed into his car, causing him to stop. 3 assailants got out of the vehicle and opened fire on Jordan. He alighted from his vehicle and was able to run a short distance but collapsed. He was pronounced dead at hospital. Vendors robbed by armed men. A vendor and his wife selling vegetables by the roadway were robbed at gunpoint on Monday. The robbers took the couple's vehicle, the day's sales, and a cell phone and escaped. The couple was plying their trade at Rivulet Road, Couva, in the vicinity of NP gas station when around 5:15 p.m. they were accosted by 2 men brandishing firearms. The men exited a white Nissan Tiida and announced a robbery. They then stole $1,500, their white Toyota Fielder station wagon valued at $65,000, and a Samsung A1 cell phone valued at $1,400. A report was made at the Couva police station, and PC Hassan Ali is continuing investigations. Prime Minister delivers warning about COVID-19's impact on the healthcare system. Amid a third COVID-19 wave and a record 31 deaths yesterday, if current trends continue, the parallel healthcare system will be overwhelmed in a matter of days. Prime Minister Dr. Keith Rowley warned last night during a 47-minute address to the nation in the COVID response. As such, this will manifest in our ability to provide care, not only to our COVID-19 patients, but to our other patients accessing general medical care and emergency care. I caution you today that while we're doing all that we can to prevent this, our healthcare system is under imminent threat. Rowley said he is still hoping to reopen beaches for Christmas and would give the numbers a couple of weeks to see where they are going. If there is no further significant deterioration, reopening could start with early morning hours from 5 a.m. to 12 noon. We have reached a critical crossroad in the management of the COVID-19 pandemic in TNT. Based on the increasing number of COVID-19 cases over the past weeks and with no decrease in sight, the number of deaths has continued to increase with dozens of persons losing their lives on a daily basis. The health ministry, which itself is closed for sanitation today, yesterday reported 624 new positive cases among TNT's total of 68,288 cases since March 2020. And there are 527 people in hospitals. There's been a total of 2,040 deaths so far, including 31 deaths yesterday alone. The figure of 31 surpassed the last highest figure, 28 recorded last Saturday. Another child also died yesterday, and 14 babies under 1 year have been reported among patients in the last 3 months. Rowley said, "We mourn the loss of over 2,000 of our citizens who succumbed to a virus over the last 18 months. The trauma has been protracted and relentless as we confirm almost 700 new infections each day and provide care for over 500 COVID-19 patients in our almost filled hospitals." Even as I was preparing this presentation, I received the depressing news that a new variant has appeared in Botswana, which some scientists are already saying could be worse than nearly anything else about, and it may even become vaccine resistant. In TNT, Rowley said the current 7-day rolling average of positive cases as of November 22, 2021 is 518 cases per day. He said the trend indicates an established upsurge in the transmission of COVID-19 in the population, with 7 consecutive weeks of upward trending totals. Rowley said the parallel healthcare system now has 16 facilities, 9 hospitals and 7 step-down facilities. As of November 2, the parallel hospital bed capacity now stands at a total of 999 beds, 898 in Trinidad and 101 in Tobago. Against the backdrop of the current epidemiological climate as at November 22, he noted, hospitalizations have been on the rise, with 539 persons as of November 22, 2021, an increase of 105% from the low of 263 persons on October 15. Total hospital occupancy was at 65%, while ICU occupancy stood at 86%. 61 of 70 ICU beds filled in Trinidad, and 5 of 7 beds filled in Tobago. An additional 64 individuals, 17 of them requiring intensive care management, are currently awaiting transfer from emergency departments in the traditional healthcare system to parallel healthcare system. Of note, 84% of the individuals awaiting transfer are not vaccinated, including 100% of the 17 awaiting ICU. He said vaccination in collaboration with public health measures continues to be a powerful combination, and vaccines continue to be highly effective at preventing hospitalization and death. Fully vaccinated people with breakthrough infections from this variant appear to be infectious for a shorter period. But Rowley added, unfortunately, it seems that we have been desensitized and the population is no longer stirred to wise action by this alarming trend. There is little change in public behavior and attitude, as well as a drastic reduction in the rate of vaccination, even in the face of increasing COVID-19 deaths. There is also a lot of information that many persons hide their condition, refuse to be tested, or isolate when they know that they are sick if only to be allowed to circulate as normal. This is exactly the environment in which the virus will thrive and show up in our intractable daily numbers and overflowing hospital wards. I tonight appeal to families to support one another and help out so that infected members can isolate to reduce the chances of the virus spreading among family members and the general public. Quarantine works, vaccine works, mask wearing and sanitizing works. Adopt them to save a life, even your own. He said government has done all it can to ensure vaccines are readily available. We've brought vaccines to you where you are, yet we've observed only an incremental change in the vaccination rate of about 0.1 to 0.2 of the general population on a daily basis. Get vaccinated, encourage others. While it may not prevent you from getting infected, it would almost certainly keep you out of the hospital wards. Even as we continue to expand our public healthcare capacity, we will soon reach the limit of our ability to provide care for those who are ill if we do not make drastic changes now. Our healthcare system is finite, and we will be forced once again to pull resources from non-COVID-19 sites into the parallel healthcare system. The elasticity and resilience of this system has seemingly given the population a false sense of complacency. He said government has already signaled to the population that it's escalating the emergency response levels in the public healthcare system and has alerted supporting agencies of the potential need for reinforcements. We would do well to ponder on what the next phase of the COVID-19 response might look like if we continue on this trajectory. As with any emergency response, as the demand on healthcare resources increases, we may have no choice but to redirect our efforts from providing the highest level of care to a few, to providing the greatest good for the greatest number of persons. He noted pandemic devastation in international and regional countries and harsh measures they've adopted to deal with COVID's effect. I mentioned these situations and decisions so that if it ever gets to the point where we have to adopt any of these additional measures, it will not be because we are incompetent, arrogant, dictatorial, or anti-democratic. It would simply mean that our situation demands it, and we do live on planet Earth where COVID-19 is attempting to reign predominant. As at September 2021, he said government had spent $509.7 million on the national COVID-19 response. At no point do we intend to concede that this fight with the virus is beyond us and is therefore unwinnable. We will fight it and keep adjusting as required, even as the virus keeps mutating. Prime Minister Rowley also reiterated that government will not shut down the economy again, as it did last year into this year to prevent the rapid spread of the disease. I want to re-emphasize at this juncture that we intend to keep on fighting this virus, whilst fighting to preserve our key economic activities which we need to maintain livelihoods. We will try to prevent devastating restrictions, and we will resort to such measures only as a last resort when all else become impotent, he said. We will continue to keep our economy open. There have been a number of demands for further opening up of the few areas which are still under restriction. Much as I would like to open up beaches and rivers, as I wanted to do a few weeks ago, the current situation militates against that. I did say earlier I'm hoping that we could open beaches for Christmas. I'm still on that. I will give the numbers a couple of weeks to see where they are taking us, and if there is no further significant deterioration, we could start with early morning beach openings from, say, 5 a.m. to 12 noon. We should be able to have therapeutic dips at dawn without the parties at afternoon and sunset. He added, very soon the Christmas season and its festivities will be upon us. We will want to have a good Christmas, but we must be particularly careful to not let the Christmas be the event that pushed us over the edge. I know you will want your family with you. Make plans to have your family as a safe zone. Aim to celebrate in safe zones. Get your family protected by vaccination. Protect your elderly and comorbid members from you. Try and avoid a funeral for Christmas. Act now. Get vaccinated. He said government also had received good advice after extensive consultation about Carnival. Carnival 2022 will not see street parades, unvaccinated gatherings, and wild public partying, but there is room for safe zone. Venue-specific events where some elements of the festival can be sampled as a carnival microscopic mosaic with a difference, Rowley said. Citing citizens' resilience, he added, "Painful and distressing as this situation is, now is not the time to concede defeat in any way. Now is not the time to get tired, careless, or carefree. Hope is good and luck is welcome, but they are no substitute for being sensible or reasonable. Now more than ever, we must not lower our guard, but instead commit to fight this scourge with everything at our disposal, not the least of which are the vaccines we have and the personal responsibility we must adopt. The virus has pushed back, and today we must stand and hold the line." New Zealand, with 83% vaccinated, requiring vaccine passports for participation in activities from December 2nd, requiring teachers and workers in the health disability sectors to be fully vaccinated, and keeping borders closed to most international travelers until April 30. Australia, vaccinations mandatory for high-risk aged care workers, employees in quarantine hotels. Western Australia requires mining, oil and gas exploration employees to have their first dose by December 1st and be fully vaccinated by January 1st, 2022. In the USA, where COVID-19 is surging in 30 states, all federal workers and contractors ordered to be vaccinated. Mandate for private sector workers to be vaccinated or tested weekly will be enforced from January 4th, 2022. The U.S. government also requires employers with 100 or more employees to get employees vaccinated by January 4th and require unvaccinated employees to produce proof of negative test results weekly. Canada, placing unvaccinated federal employees on unpaid leave, requires COVID-19 shots for air, train, and ship passengers. All of its 338 lawmakers must be fully vaccinated against COVID-19. Any core federal public servants, including members of the Royal Canadian Mounted Police, unwilling to disclose their vaccination status or be fully vaccinated will be placed on administrative leave without pay from November 15. Barbados, with 50% vaccination level, has a 9 p.m. to 5 a.m. curfew. Antigua, with 57% vaccinated, where ages 12 to 18 who are unvaccinated cannot attend school. Unvaccinated government employees must remain away from work without pay. State of emergency until December 22nd. Jamaica has 9 p.m. to 5 a.m. curfew until December 9, plus limits on gatherings. Guadeloupe has an explosive situation following a week of violent protests over vaccine mandates which exclude the unvaccinated from many normal activities. France required all healthcare and healthcare home workers, home aides, and urgent care technicians to have had at least their first shot by September 15. Around 3,000 workers were suspended for failing to comply. Those aged 65 and above must present proof of a booster shot from mid-December for health passes that give access to restaurants, trains, and planes to remain valid. Switzerland requires people entering bars, restaurants, and fitness centers to show a COVID status certificate proving proof of vaccination, recovery from infection, or a negative test result. Italy made COVID-19 health passes mandatory for all workers. Those unable to show proof of vaccination, a negative test, or recent recovery from infection would be suspended without pay and face a fine if they try to keep working. Health workers, including pharmacists who aren't inoculated, could face suspension without pay for the rest of the year. Austria placed millions not fully vaccinated in lockdown from November 15. It banned the unvaccinated from places including restaurants, hotels, theaters, and ski lifts. Austria will also make vaccination against COVID-19 compulsory from February 1st. There will be penalties for people still refusing the jab after that. Latvia banned lawmakers who refused the COVID-19 vaccine from voting and docked their pay. On November 4, it allowed businesses to fire workers who refused to either get vaccinated or transfer to remote work. Singapore, from December 8, will no longer pay the COVID-19 medical bills for people unvaccinated by choice.